You know, when you see that plaque or logo in a hospital, some kind of accreditation, it makes you feel a little better, right? But what does it really tell you about the care you're going to receive? Today, we're diving deep into one specific accreditation body, the National Accreditation Board for Hospitals and Healthcare Providers, or NABH.
Exactly. We've gathered information straight from NABH along with insights from a consultancy that helps hospitals achieve this accreditation and even dipped into a podcast discussion about the real-world process.
Okay.
Our goal for you today is to look beyond the acronym and understand what NABH truly signifies for both patients and hospitals, and to get a clear picture of how a hospital even goes about earning this mark of quality.
Right.
Consider this your shortcut to becoming well-versed in a really vital aspect of healthcare. Okay, so let's start with the basics. What exactly is NABH?
Yeah, let's do that.
Well, as we've said, NABH stands for the National Accreditation Board for Hospitals and Healthcare Providers. And it's actually a part of a larger organization called the Quality Council of India, or QCI. Think of NABH as the specialized healthcare division within this broader quality framework.
So NABH isn't entirely its own independent entity.
That's right. The QCI established NABH specifically to develop and operate an accreditation program tailored for healthcare organizations. The fundamental aim was to address the needs of patients, that's you, and to establish clear benchmarks for the healthcare industry to strive for, ultimately raising the standards of care.
So it's about pushing the entire industry forward in terms of quality.
Precisely.
Yeah.
And while NABH has its own operational independence and makes its own decisions regarding its programs, it receives support from various stakeholders, including the healthcare industry itself, consumer advocacy groups, and the government.
Yeah, interesting.
It's structured to have functional autonomy within the larger healthcare ecosystem.
Okay. When did NABH actually start doing this work?
Well, NABH's hospital accreditation program was launched back in 2005. That's their main program, the one you most commonly hear about. And here's something really interesting. Those NABH standards aren't just recognized within India. They've actually achieved international recognition and have been accredited by ISQA. That's the International Society for Quality Assurance in Healthcare.
ISQA.
Yeah. This international endorsement really lends credibility to the rigor of their standards, putting them on par with global best practices.
Wow, international recognition. That definitely suggests a significant level of scrutiny. You mentioned the Quality Council of India. Can you tell us a bit more about what the QCI is and how it fits into this whole picture of accreditation?
Sure. The Quality Council of India, or QCI, is the national body responsible for accreditation across various sectors in India. It was established quite a while ago in 1996.
96, okay.
And what's fascinating is that it was created through a partnership between the public and private sectors.
So both the government and private industry were involved right from the beginning.
Exactly. It was formed based on recommendations from a European Union expert mission with strong support from major Indian industry associations like ASSOCHAM, CTI, and FSACI, as well as the government of India. So it's a collaborative national effort aimed at promoting quality standards across different industries, with NABH being its healthcare-specific arm.
And who is currently leading the QCI? Do we know?
Yes, the current chairperson of the QCI is Mr. Jagsay Shah, and the Secretary General is Mr. Chakravarti T. Kannan.
Okay, so NABH operates under this national umbrella of the QCI. Now, let's get to what's really important for you, the listener. Why should you care if a hospital has NABH accreditation? What are the tangible benefits for a patient?
Right. So for you as a patient, NABH accreditation places a significant emphasis on your safety. Accredited hospitals demonstrate a commitment to providing quality care, which ideally translates to better clinical outcomes. You should also experience improved patient satisfaction. These hospitals have been assessed against specific standards in how they manage patient care, communicate with you, and ensure your overall experience is positive.
So it's not just about the medical treatment itself, but also about how you are treated as a person within the healthcare system.
Precisely. And because NABH accreditation indicates that the hospital's medical professionals are appropriately qualified and the facility has met defined quality benchmarks, it can also increase your confidence in that healthcare provider.
Yeah, I can see that.
Knowing there's an external validation of their standards can be very reassuring when you're making crucial healthcare decisions.
That makes a lot of sense. Knowing someone else has come in and checked things out can definitely ease your mind. What about the hospitals themselves? What motivates them to go through the often rigorous process of getting accredited?
Well, for hospitals, there are several compelling advantages. In today's competitive healthcare landscape, NABH accreditation can be a significant marketing tool. It signals to potential patients that they are dedicated to quality and safety.
Right. It sets them apart, maybe?
It can. Furthermore, because NABH standards have international recognition, it can attract patients seeking medical treatment from other countries, boosting medical tourism.
Ah, medical tourism, yeah.
We've even heard from consultancies that some hospitals see a direct increase in inquiries from international patients after achieving NABH accreditation, which can represent a tangible return on their investment.
So it can really broaden their reach.
Absolutely. And on a more practical level, NABH accreditation provides an objective framework for empanelment by insurance companies and other third-party payers.
Insurance, okay.
It simplifies the process of getting approved to provide services to their beneficiaries, which is crucial for their business operations.
That sounds like a pretty significant business advantage for hospitals. So who is actually eligible to apply for NABH accreditation? Is it something any healthcare facility can pursue?
Well, the primary NABH hospital accreditation program is designed for healthcare organizations that are currently operational and have more than 50 sanctioned beds.
More than 50 beds. What about smaller places?
Yeah, smaller facilities, those with fewer than 50 beds, can pursue accreditation under a different set of standards called SHCO standards, which are specifically tailored to the resource limitations and operational context of smaller healthcare organizations.
Okay, so there's a size consideration. What else do they need to demonstrate to be considered eligible for NABH accreditation?
Any organization applying must demonstrate a clear commitment to adhering to all the relevant NABH standards, as well as all applicable legal, statutory, and regulatory requirements.
So all the rules.
All the rules. It's not just about meeting some of the criteria, it's a commitment to the entire framework of quality and safety. And importantly, these standards apply comprehensively across the entire organization, not just to specific departments or services.
The whole place.
The whole place. Whether it's a public or a private hospital, the accreditation covers all aspects of patient care and hospital operations.
So it's a really comprehensive evaluation of the entire hospital. Now, what exactly do these NABH standards focus on? What are the key areas that they examine?
The NABH hospital standards are organized into 10 distinct chapters, each addressing a critical aspect of hospital operations and patient care.
10 chapters, okay.
The first is Access, Assessment, and Continuity of Care, or AAC. That looks at how patients access the hospital, how their needs are evaluated upon arrival, and how their care progresses smoothly throughout their stay and beyond.
That makes sense from the moment you walk in to when you leave and continue your recovery. What's the next area?
The second chapter is Care of Patients, or COP, which focuses on the actual delivery of medical care and treatment.
COP, got it.
Following that, we have Management of Medication, or MOM, which, as you can imagine, deals with the safe and effective handling and administration of medications.
Crucial.
Very. Then there's Patient Rights and Education, or PRE, a crucial chapter that ensures patients are informed about their rights, are involved in their care decisions, and receive adequate education about their health conditions and treatment options.
Those all seem like really fundamental aspects of good healthcare. What other areas do the NABH standards cover?
Another vital area is Hospital Infection Control, or HIC. That focuses on preventing and managing infections within the hospital environment, something that's clearly paramount for patient safety.
Oh, absolutely. HIC.
Then, Patient Safety and Quality Improvement, or PSQ. This chapter looks at how hospitals proactively identify and mitigate risks to patients and continuously work to improve the quality of their services.
So always getting better.
That's the goal. The Responsibilities of Management, or ROM, chapter examines how the hospital's leadership and governance structures are in place to ensure quality and safety throughout the organization.
So it's not just about the clinical staff. The management and leadership have a significant role to play as well.
Absolutely. They set the tone. Then we have Facilities Management and Safety, or FMS, which covers the physical environment of the hospital, ensuring it's safe, well-maintained, and conducive to patient care.
The building itself.
Right. Human Resource Management, or HRM, focuses on the competence, training, and well-being of all hospital staff.
Makes sense. Need good people.
Exactly. And finally, the Information Management System, or IMS chapter, looks at how patient information is managed, kept secure, and utilized to improve the quality and continuity of care.
Patient records and data security. That's huge now.
It really is.
That's a really comprehensive overview, covering everything from the patient's direct experience to the underlying infrastructure and the people who provide the care. So if a hospital decides that they want to pursue NABH accreditation, what's the very first step they need to take in the application process?
Okay, the initial step is for aspiring organizations to apply online through the NABH website. The entire application process now starts with a digital registration.
That sounds straightforward enough.
Yeah.
Is there any preliminary information they can access before committing to the full application? Like, can they see what they're getting into?
Yes, definitely. NABH provides a comprehensive general information brochure free of charge on their website.
Oh, cool.
This brochure offers a good overview of the accreditation process and what's involved. Furthermore, the complete document outlining the hospital standards is also available as a free download.
The actual standards.
For free, yes. This allows hospitals to thoroughly review the requirements before even beginning the formal application.
It's great that they make so much information readily available. What if a hospital wants an even more in-depth guide to help them through the process?
For a more detailed and practical guide, NABH also offers a publication called The Guidebook to NABH 5th Edition Standards for Hospitals.
Okay, a guidebook.
This provides a more granular explanation of the standards and how to implement them. However, this guidebook is available for purchase, and the current price is Rs 6,000.
6,000 rupees. Okay, so there are free resources for initial understanding and a more detailed guide available for a fee. What about the actual costs associated with applying for and maintaining NABH accreditation? I imagine those fees might vary depending on the size of the hospital.
Yes, the application fee and the annual NABH accreditation charges are indeed structured based on the number of sanctioned beds in the hospital. There are different fee categories.
Different tiers.
Exactly. For hospitals with up to 100 beds, those with 101 to 300 beds, 301 to 500 beds, and hospitals with 501 beds and above. Tax. Additionally, there's typically a fee associated with the virtual assessment component of the accreditation process, and this also varies depending on the hospital's bed capacity. So it's a significant financial commitment, particularly for larger institutions.
It definitely sounds like a substantial investment. Does NABH offer any direct support to healthcare organizations as they navigate this complex process? Do they help hospitals out?
Yes, they do. The NABH Secretariat organizes regular training sessions known as Program on Implementation, or POI. Right. These programs are specifically designed to help hospital staff understand the intricacies of the NABH standards and learn practical strategies for implementing them within their own organizations.
Who runs these?
These sessions are typically led by senior assessors from NABH, offering valuable insights directly from the experts. Details regarding these training programs, including schedules, locations, and fees, are available on the NABH website.
That sounds incredibly beneficial, getting guidance directly from the people who will be assessing them.
Yeah.
Are there any other ways NABH provides support and fosters learning?
They also have an initiative called NABH Quality Connect Learning with NABH.
Quality Connects.
Yeah. This includes free monthly masterclasses covering a wide range of topics related to quality improvement in healthcare, such as understanding key performance indicators, KPIs, implementing effective hospital infection control measures, and optimizing medication management practices.
Free masterclasses, that's great.
It is. Furthermore, their website's resource page offers a variety of guidance documents, templates, and other materials that hospitals can utilize.
It seems like NABH is actively working to empower hospitals through education and resources. Now, we also looked into healthcare consultancies like Supremediq Consultancy Private Limited. What role do these types of organizations play in assisting hospitals to achieve NABH accreditation?
Right. Consultancies like Supremediq offer comprehensive end-to-end support to hospitals throughout their NABH accreditation journey.
End-to-end, huh?
Pretty much. Their services can encompass everything from the initial strategic planning and infrastructure setup to refining day-to-day operational processes and ensuring that the hospital effectively meets the objectives of the NABH standards by adopting best practices in all areas.
So they hold their hand through it.
In a way, yes. They essentially act as expert guides, helping hospitals navigate the complexities of the accreditation process.
So they're like specialized guides who have been through this many times before.
Exactly. They possess specific expertise in areas such as implementing quality management systems, with a particular focus on NABH requirements, as well as overall hospital operation management and ensuring compliance with all relevant regulations.
Okay.
For instance, Supremediq highlights the extensive experience of Dr. Sutaram Vishnoi, who has a strong background in hospital strategy and quality management, coupled with leadership experience in various hospital settings and training from prestigious institutions.
So they bring in real experts.
Right. Having this level of experienced guidance can be invaluable for hospitals, especially those that are new to the accreditation process.
It definitely sounds like having that kind of expert support can significantly streamline the process and increase the likelihood of successful accreditation. Now, our research also included a transcript from a podcast episode where they discussed the real experiences of hospitals undergoing NABH accreditation. What were some of the common challenges that were highlighted in that discussion?
Yeah, that podcast transcript shed light on several common hurdles that hospitals frequently encounter.
Like what?
Well, these often include the need for a well-trained staff that not only understands the NABH standards, but can also effectively implement them in their daily work.
Staff training, always key.
Always. The significant amount of documentation required to demonstrate compliance across all 10 chapters of the standards was also a recurring challenge. Paperwork.
Oh, I can imagine. Mountains of it.
Exactly. Additionally, some hospitals face infrastructure limitations that need to be addressed to meet certain requirements.
Like physical building issues.
Sometimes, yeah. Finally, the podcast touched upon the inevitable resistance to change that can sometimes occur within a hospital staff and the broader organizational culture when implementing new processes and standards.
People don't always like change.
Not always easy. One hospital administrator in the podcast even described feeling overwhelmed by the initial amount of paperwork, highlighting that while the ultimate goal is quality, the journey itself can be demanding.
Those all sound like very real and understandable challenges for many hospitals. What kind of solutions or strategies did the podcast participants suggest for overcoming these obstacles?
Well, the podcast offered several practical strategies. A key solution emphasized was investing in robust and ongoing staff training programs to ensure that everyone understands the standards and their individual roles in achieving and maintaining them.
Makes sense. Get everyone on board.
Right. Engaging experienced consultants like Supremediq was also recommended as a way to provide expert guidance, streamline the process, and help avoid common pitfalls.
Bring in the pros.
Exactly. Implementing digital record-keeping systems was suggested as a way to improve efficiency and manage the significant documentation requirements.
Go digital, yeah. Use paper.
Hopefully. And finally, adopting a phased approach to implementation, breaking down the extensive changes into more manageable steps, was highlighted as a way to reduce resistance and make the overall process less daunting for everyone involved.
Don't try to boil the ocean all at once.
Exactly. Take it step by step.
That makes perfect sense. A structured approach with expert guidance. A focus on empowering staff through training and leveraging technology to manage the workload. Did the podcast also provide any insights into the actual impact that achieving NABH accreditation has had on hospitals in the real world? Did it, make a difference?
Yes, it did. The podcast transcript included anecdotal accounts of the positive transformations experienced by hospitals after successfully achieving NABH accreditation.
Such as?
These included a notable increase in patient trust, attributed to the hospital's demonstrated commitment to quality and safety.
Okay, patients feel better about it.
Seems so. There were also mentions of a reduction in medical errors as a result of the more standardized and rigorous processes implemented.
Fewer mistakes, that's huge.
Absolutely. Interestingly, some participants even reported a positive impact on the hospital's financial performance, potentially through attracting a larger patient base and securing more favorable contracts with insurance providers.
So it might even help the bottom line.
Potentially, yeah.
So it seems that the benefits extend beyond just having the accreditation itself. It leads to tangible improvements in how the hospital functions and the outcomes for patients.
Exactly. The accreditation serves as both a validation of current quality standards and a catalyst for continuous improvement across all aspects of the hospital's operations.
Okay, so let's bring all of this together for you, the listener. What would you say are the most important things to remember from our deep dive into NABH accreditation?
Okay, 3 main things, I think. Firstly, understand that NABH accreditation is a significant indicator of a hospital's dedication to quality and patient safety. It's more than just a certificate. It signifies a rigorous evaluation process and an ongoing commitment to internationally recognized standards.
Right, it means something.
Second, while achieving NABH accreditation is a demanding undertaking for hospitals' time, money, effort, it offers substantial benefits. These range from enhanced patient care and satisfaction to a stronger market position and improved relationships with third-party payers like insurers.
Benefits for patients and the hospital.
Yes. And finally, remember that this is a structured process. It requires a thorough understanding of the detailed standards, might involve seeking expert consultancy support, and invariably necessitates significant investment in staff training, robust documentation, and continuous process improvement. But NABH itself does provide resources to help.
It's a journey, not just a destination.
Well put.
That's a fantastic summary. And here's a final thought for you to consider. What implications could a widespread adoption of such stringent accreditation standards have for the overall quality of healthcare in our country? And how might that, in turn, influence the level of trust that you, as a patient, place in your healthcare providers?
Good question.
Understanding hospital accreditation isn't just about the inner workings of medical facilities. It's really about empowering you to make more informed decisions about your own health and well-being. If you're interested in learning more, we encourage you to explore the NABH website and the other resources we discussed today. It's a deep dive that can truly empower you.